This video is aimed at giving you an appreciation for what is going on at your body. I want to teach you the anatomy and mechanics of what actually happened when you got this split down the middle. So here we're looking at the front of the body with the different layers of abdominal muscles. Do note that although they appear separate, all these different layers, all these muscle groups work harmoniously together. You can't isolate any one of these muscle groups, so don't think you can contract your transverse abdominis with a certain action. No, they all work together, and we want them working together to give us strength and power, but we want them to work together efficiently and correctly. So, superficially, we have the external oblique. Some ladies are using this muscle too much, and which puts more stress in the middle. Some ladies. Deeper, we have internal oblique layered approximately with the rectus abdominis, the muscle we're all talking about today, where we have this gapping in the middle. The six-pack muscle, it runs all the way from the pubic bone all the way up to the sternum. So whenever you're doing your self-assessments, please do check the full length of this linea alba, which is the fascia, white, tough tissue in the middle that does have that gap in it. Check the whole length. Deeper to that, we have the transverse abdominis, the corset-like muscle. The fibers run horizontally to give you that inherent stability, and it is neurally tied in with your diaphragm. Coming up next, we'll talk about that, and pelvic floor. A different view of the anatomy. We're still looking at the front of the body, so here's the spine and the back, but we've taken away all those abdominal muscles and the organs. So now you can see the layers of abdominal muscles, 3 layers on either side. But look at this, the diaphragm, this big dome of muscle. How important do you think that must be to bring us stability in the core? It runs all along with the spine and the abdominals. And then, of course, the pelvic floor, the deep muscles in the bowl of the pelvis, the foundation from which our whole body can move. So I just want you to appreciate that the diaphragm, abdominal muscles, and pelvic floor are all connected. Here's your side view. You can see the diaphragm doming upward, pelvic floor, hammock at the bottom, and the especially transverse abdominis connecting into what? Guess what? The linea alba in the front, and these little multifidi and spinal muscles are oh so important for holding us up and doing rotation motions with our trunk. This is the inner core piston. What I'm talking about should be synced together. How we contract our diaphragm, pelvic floor, and abdominals is so important for bringing tension and a little bit of good stress to the midline so that we can lay down new connective tissue and build up strength back to this midline. Previously, we looked at what a normal non-diastasis recti body would look at. This is also a normal body. Let's check out the cross section. So we're taking basically a slice from the trunk, and you can see adipose tissue, organs, and in the middle are abdominal muscles. Okay, the rectus should be oh so strong. Great trunk flexors of our body. The linea alba, where we have a gapping now, but we want to generate strength and tension across this midline. And here are our layers of abdominal muscles inserting into the big rectus sheaths. Okay, and of course, diastasis, midline, a stretched linea alba, sometimes a completely gapped linea alba. Maybe it's just that. Maybe it is just a stretch. Maybe it has, over time, completely separated. There's not going to be any traumatic popping of this really tough, strong connective tissue. But at some point, maybe it did get a little more than stretched and it completely gapped. So we're going to create tension across this midline, bring strength to these muscles, build back up the inner corset of the abdomen, and get this flattening out for you. As we are uniquely made and we have unique movements and bodily history, bodily traumas, so are our variations of gapping in our abdomen. All right, normal abdomen without diastasis, pre-pregnancy, likely. This woman has never been pregnant before. Okay, moving on. You may have a gap right around your belly button. You may have a gap that is below your belly button, above or along that full, like I mentioned earlier, sternum to pubic. So that's why it's so important for you to self-assess in varying postures and movements to get a grasp on what exactly is going on with your body. It might not be right around your belly button, as typically is put out there into the internet. Check and see what's going on, see what movements are particularly making your abdomen gap, and then you'll know what you really have to work on to gain that strength back. A few more tips, tricks, tidbits to hopefully demystify and take any fear out of what you see when you look down and your abdomen is doming or bulging. So we really don't know why. There's no firm research. We just don't have enough research to show why gapping and stretching of the linea alba happens. It could happen during birth. It could happen during pregnancy. It could happen before with poor breathing and pelvic floor stability. We, again, don't know why. I've seen numbers anywhere from 60% of postpartum women to 90% of postpartum women. I even think it's 100% based on anecdotal data in my clinic and the abdomens I've felt coming through my physical therapy office. So hopefully that gives you comfort that you're not the only one and this is a real problem, and as a society we should be talking about it. And also with this awareness comes, yeah, you can do something about it. What can you do? It's in your control. You're educated and you know that there's an issue and your body isn't functioning as efficiently as it could be. So let's get it. Consistency is key. Do your 5 to 6 workouts, exercise classes a week. Be aware of your posture and your breathing daily. It's something that's just going to integrate into your routine, and these things are going to put the appropriate low amount of stress we need in the midsection to form new tissue and close that gap. Provide yourself with adequate nutrition. Add in a collagen supplement. Make sure you're getting all of your omega-3s for the day. Make sure you're eating an adequate amount of protein, about 45 grams for women, so that we can build up muscle and create a strong mom bod for ourselves. Belly binders. I get this question sometimes about if I can wear a belly binder. Would that be helpful in closing my diastasis? Well, to me, if you're putting pressure around your midsection over your abdominals, that's going to create more pressure going up towards the diaphragm and pelvic floor. So you might create more of a dysfunction with the whole system. What I'd rather you do is train your body to work for you and get proper breathing mechanics down and proper posture to make an inner corset of muscles, especially with those transverse abdominis, and make your body work for you. Surgery, the scary S word. How do I know if I'm going to need surgery? What if this program doesn't work? Surgery usually is reserved for severe cases of diastasis. There are no norms researched yet. However, what I've heard tossed around lately is under 4 centimeters gap. That's a minimal gap. There's still a dysfunction in the system. You're not as strong as you could be. That puts you at risk for back pain, incontinence, other dysfunctions. There's still something going on, but under 4 centimeters is a minimal gap. 4 to 8 centimeters is a moderate gap. Over 8 centimeters is a severe gap. And possibly, if there's that amount of gapping in the tissue, it's not going to fully come back together, not giving you that fully efficient, strongest core inner piston system. And that's when we're speculating surgery. However, these women still can lead active, happy lifestyles. Is it a means of better function to have surgery, or is it an aesthetic mean? And either one is super valuable to a woman. So I think that you have to try first to become as strong and functional as you can, and then approach surgical options. But let's try our hardest. I would give it at least 18 months of effortful strength training, breath work, posture reintegration before surgery is even an option.